Today we raise awareness for severe ME. It's estimated that about 25% are housebound and bedbound. I know firsthand how hard it can be, and not just because it's debilitating, but also because the more ill you become, the less care you receive, even though you need it the most. In the 12 years that I'm now housebound and mostly bedbound, I have not seen any treating physician. 12 years. For me, that is incomprehensible, also considering that in those times I have been critically ill. And it wasn't that my GP didn't care, but she just didn't know what to do. And instead of acknowledging that insecurity, she became dismissive, and eventually she also became neglective. When things got really bad, she sent a psychiatric crisis team to me, even though there was no indication for it. And that added stress was really the last thing I could use in my state. My story is unfortunately not rare. Mistreatment and neglect are widespread. At times, families are torn apart because parents are being accused of child abuse because the child can't attend school anymore, or they try to protect them from CBT and GETS. That can be harmful for us patients. The lack of care has also caused preventable deaths, and at times parents are being blamed for it. Can you imagine the trauma of losing your child, and then with a disease with little to no help, and that you are being accused of causing it? Instead, this is a systemic failure where doctors aren't being trained to recognize and treat ME, especially severe ME. The amount of people that die by suicide or that apply for euthanasia is staggeringly high. And it's not that they want to die, but they're left without support, without hope, and the suffering is so immense that it becomes impossible for them to endure. If I hadn't lived it, I would have thought that a video like this was probably exaggerated, but I am not exaggerating. I wish I were. Luckily, there are doctors who truly care, but ME has been so neglected in research and biomedical understanding for decades that we simply do not have any effective treatments. So despite their dedication, they have very limited tools to treat us. Before my illness as a pro athlete, I had a good experience and relation with healthcare, but I could have never imagined that a system like this would fail me so completely when I became this ill. In my opinion, this is not how healthcare should be. We need to do better. We need more research, better treatments, and compassionate, informed care. I think it is really important to emphasize that this is not just a tragedy of the disease alone, but this is a systemic failure, and that failure needs to end. And I believe that together we can make that happen. So please speak up for people with severe ME, so that our healthcare does not lead to another health scare. Thank you.